We're going to talk about the cervical artificial disc replacement. My name is Dr. Pablo Pazmiño. We're seeing more and more that patients prefer hand-selecting the surgeon who ultimately performs their disc replacements. We see patients regularly travel from the Northeast, from the South, and now internationally for our services and expertise with arthroplasties in particular. The medical staff at these hospitals here in California. Let's focus initially on the cervical hybrid disc replacement. That's a surgery where you perform a combination of a fusion and a disc replacement. Here's our patient one day after surgery.
Prior to yesterday's surgery, I was in pain at a level of 3 to 8, depending on my activity level. Now, other than a little sore throat and a little muscle tightness in the back, I have no pain. It's no extra tingling sensations, no numbness. It's great.
Great. And what surgery do we do on you, Gary?
You did a fusion between C6 and C7, removing the disc completely out of that. And then in C4 and C5, you put an artificial disc in.
Great. Let's see your range of motion after the first day. Good. Perfect. Okay, sounds good. And then you're going home today.
Great.
Here's that same patient now 2 weeks after surgery.
Hi, it's been 15 days since I had my surgery. There was a complete discectomy between 6 and 7 with a fusion, much like this little device in here. And then there was another artificial disc put in between C5 and C4, which is this little job here. And you can see it on the x-ray. That's my x-ray that was taken this morning. As far as recovery, it's only been 15 days. I've got great range of motion. I have almost no pain. There's just a little tiny bit of muscle tightness, but there's no tingling or electric shock or any of the things that were plaguing me for months before this surgery. The up and down is great. Rotation is great. I have no lingering problems. I'm very happy.
Great. Where was your pain before surgery?
All in my left arm, and it was dependent upon the positioning of my head. It would go from numbness to tingling, could be a lightning bolt. It just depended on where my head was and what I was doing at the time.
And then after surgery, did you notice that pain was still there? Or?
No, it was completely gone when I woke up.
Great. Okay, thanks.
I hope you enjoyed that video on cervical artificial disc replacements. Again, my name is Dr. Pablo Pazmiño. Here's our contact information if you or someone you know may benefit from a cervical disc replacement.